Hello, everyone, and welcome to another Career Chat video. My name is Joan Dixon, and I'm the Director of Student Programs at Gulf Coast South Area Health Education Center. You can see on our screen our REACH student programs that we have available, as well as my information at the bottom of the screen, our website, my phone number, my email address, and please know that all 6 of these programs are absolutely free of charge to students. It can start with the Reach Health Careers presentation that's recorded and it's out on our website to help you explore the different types of health careers that are out there. Over 300 careers in health for you to choose from. We also have these career chat videos, many videos, pharmacists, techs, technologists, doctors, nurses, health educators, medical interpreters, you name it. So you can watch the chat and see if that career interests you. We put on health career camps during the summertime, so always keep an eye out for those. If you're part of a HOSA club, that's Health Occupation Students of America, feel free to give me a call or send me an email and I can come in and help your club prepare for the regional, state, and international competitions. Should you be interested in public health, I do have an internship program for high school students and college level students. And then once you get into college as a graduate student, you can apply for our AHEC Scholars Program, which is 2 years of intensive work learning all about the ins and outs of public health. 6 programs free of charge. My information's on the bottom, so feel free that you can always pause this video and give me a call or send me an email. I'm very pleased today to have our guest speaker on Zoom with me. Today, I am welcoming in Kim Baston. Kim has a doctorate degree in education. Formerly a dental hygienist, Kim is currently working at State College of Florida as the director of the dental hygiene program and the assistant dean of health professions. For those students out there listening, thinking, maybe dentistry, I might be interested in that. I'm interested in teeth. Well, let me tell you about dental hygienists. The dental hygienists perform the following duties: the assessment of oral health conditions, review of health history, oral cancer screening, head and neck inspection, and dental charting. They also take dental x-rays. They remove calculus and plaque, that's the hard and soft deposits, from all surfaces of the teeth. They apply preventive materials to the teeth, such as sealants and fluorides. They teach patients about appropriate oral hygiene strategies to maintain oral health. So when they ask you if you've been flossing and you say, yes, I have, they know if you're lying, they can see it in your teeth. They also counsel patients about good nutrition and its impact on oral health. And of course, they perform documentation and office management activities. That's a lot. They do a lot, dental hygienists do. So welcome, Kim. Did I leave anything out about that job description?
I don't believe so. It was a very nice description. I appreciate that.
Do you remember those days when you did so much beside the chair?
Absolutely. And, to be honest, I just had a conversation with one of our current students talking about there are occasions when we are not on campus and I'll temp in an office just because I want to remind myself what our students, those challenges that they experience once they graduate, and all of the things that they have to do within the allotted time and that appointment that they have with the patient. Because as you described it, there are so many things that they have to do within a relatively short period of time.
Exactly right. And over the years, things keep progressing. I mean, we've changed from x-rays in the hand to digital
Correct.
x-rays. So
Absolutely.
much has changed.
Hmm.
There's always new medications, there's always new techniques, and I'm excited to hear about your journey from way back when you started out, and then
Right.
how you've made it to today. So we've talked about the job description of a dental hygienist.
Hmm.
What did you start out doing in this field?
So, through a recommendation of a family member, they had suggested that I become a dental hygienist. And I was a student in college, really trying to figure out what I wanted to do, was very unsure. And I thought, well, that sounds good, but what if I don't like it? What if I spend this time and effort on a profession that I don't like? So I had gotten a newspaper. So that was when we didn't have digital, and we still got a newspaper that came to the house. And I looked at jobs, and there was a job for a dental assistant, and it said no training needed. So I applied for the position, interviewed, and lo and behold, it was for a dental hygiene assistant. It was a larger office. They had several hygienists, and those hygienists would see patients on 30-minute increments, it's a very quick turnaround. So I was hired to be an assistant to the hygienist. I would bring the patient back. I would take radiographs. The hygienist would provide treatment. I would do the exam with the dentist, clean up the chair, set it up for the next patient so that hygienist could manage to provide comprehensive care to the patient within that 30-minute allotment. Once I did that, I thought, this is a pretty good job. I like this. I like what the hygienist does. I think that I'll take that recommendation of the family member, go to school to be a hygienist. And the university that I applied to, I missed the application deadline to apply for the hygiene program. And they also had a dental assisting program. So I applied to the assisting program, did a year of dental assisting, and then went straight into dental hygiene. So I actually have an associate degree in dental assisting and an associate degree in dental hygiene. And then once I completed my dental hygiene degree and I started working in clinical practice, I was very close to completing my bachelor's degree. So I finished my bachelor's in dental hygiene education, because during those years of soul searching, trying to figure out what I wanted to do, I thought I wanted to be an educator. So even in the profession of dental hygiene, it's opened the doors for me to still, do that passion that I had for education. We do education with the patient, as you described, chair side, as far as nutritional counseling, talk to them about brushing and flossing. So I had that component there. But with my bachelor's degree in dental hygiene education, that opened the door for me to start working in the college environment and teaching dental assisting and dental hygiene courses as well.
I like that you've shared that you kept moving onward and upward. That's a common theme that I have in my career chats. And I make sure to tell the students that nobody can ever take your education away from you. It's
Absolutely.
never going to be a waste of time. You can always use it as a stepping stone and keep building on it again and again. So that is fantastic. Now, when you're working in the dental office, what is the atmosphere like?
Um, Well, I think it really depends on the position that you're working in. The hygienist has a lot of autonomy, so that means they get to work independent of the doctor, and they're working very closely with patients. I always tell people, you have to have the personality to have a very close working relationship with your patients, because proximity wise, you're very close to the patient because you're working in a very small area. But also, you form relationships with the patients, and they come to see you maybe every 3 months, 4 months, or 6 months. And you oftentimes see that patient more regularly than they may see the dentist, but also more regularly than they probably see their primary healthcare provider. And that's why it's really important in our profession today that we have good working relationships with those other medical providers, because in dentistry, we see the patients very frequently in comparison to maybe how often they see their primary care physician. So we need to have a relationship where we can share information with the other healthcare providers on things that we see, because we can identify things in the mouth that could be a contributing factor for maybe a systemic condition that the patient has. And we can make that connection between the patient and their primary care physician. I kind of
That's
got off topic there, but For the other components of dentistry, like the dental assistant, they work with the doctor very closely. So they work chairside with the doctor. They're oftentimes facilitating procedures that the dentist is doing. Maybe they're doing a filling. So they're handing instruments to the doctor, mixing different materials, really managing the saliva that's in the mouth while the doctor's working so they can have a clear field of view. I would say every office that I've worked in, the atmosphere is very upbeat. We always want to try to be very positive with the patient. You have to think a lot of people, they don't like to go to the dentist, and they're oftentimes very fearful. So they need to feel like they're coming into a very positive environment. So I think most of the time people working in dentistry, they try to keep a very upbeat personality and make the patient feel comfortable when they come in.
I've experienced it myself when I go every 6 months to get my teeth clean. You know, my hygienist always greets me, asks me how the family's doing, asks me how work has been, and makes me feel at ease. So that is a big component of that. And when we're talking about patients, what kind of patients do you work with? Is there an age range?
It really depends. There are pediatric dentists, and they typically specialize in children, where a general dentist, a lot of times they'll have the full array of patients. It can be children all the way up to what we would consider geriatric, so your elderly population. In the years that I practiced, I worked for a general dentist, and we would see everybody from usually maybe 3, 4 years old, all the way up to in their 90s. And we were fortunate enough that we had some people in our office that specialized in helping patients with special needs. So we saw a lot of special needs patients. And I think it really just depends on the particular practice, on, what that doctor feels comfortable and in doing, and the patients that they feel comfortable in treating, because there are some doctors who, they'll specialize in different things and they have a very high comfort level in those areas that they specialize in. And I've always appreciated over the years if a doctor didn't feel comfortable in performing a certain procedure, if they were aware enough or astute enough to say, I think it would be better for you to seek treatment with this specialist because they specialize in that area. Because ultimately that's the goal. It's what's in the best interest of the patient and how you can best serve them.
Agreed. When we're talking about the work week, paint us a picture. How many hours do you work each day? Do you work 5 days a week? What's it like?
So I think a lot of dental offices are open 4 days a week. I There may be some offices in today's environment, because there is a shortage of dental hygienists, and it's been very hard for dentists to treat the patients coming into their office, the number of patients. We've had an influx of people, especially in Florida, moving to this area. So it's been really hard for doctors to accommodate the workload. And I've noticed that they're starting to work 5 days a week. But the profession itself, it's a very demanding profession on the body. So over the years, that's where we would see doctors working 4 days a week so they could give their body a little bit of a break and have a reprieve. But even when they work 5 days a week, a lot of times that fifth day would be a half day. So a lot of times it would be 8 to 5, and the shorter day, 8 to noon. Hygienists, depending on the office, oftentimes will see a patient once every hour. And if the case is a little more complex, because some patients need a little more time, they may have what we consider the needs for scaling and root planing, or some people will call that a deep cleaning. And it's a little more time intensive, and it might be an hour and a half appointment. Or if it's a new patient to the office, sometimes the procedures that we have to do, that long list that you went through at the beginning, it takes time. So it might be an hour and a half appointment. But traditionally, the typical day is 8 hours. And most of your dental offices, they're closed on holidays, they're closed on the weekends, where I know there's some other health professions where, depending on the location where you're employed, you could have to work holidays and weekends. So that's a bonus for dental hygiene.
But what's nice and what I'm hearing is there's not going to be a 2 a.m. phone call for an emergency teeth
That's
cleaning.
right.
So
That's right.
you can actually have a personal life on the side there and spend time with your family.
Absolutely.
What type of starting salary can a student expect coming straight out of dental hygiene school, getting that 2-year associate's degree?
So, in the state of Florida, I would say the range at this time, depending on the practice, is around $38 an hour up to 45. There are some other um, larger practices that are recruiting very heavily for hygienists, and the salary sometimes will peak a little bit higher than that $45 an hour. And again, that's supply and demand. I described that there's a high demand for our profession right now. So because there is a shortage of hygienists and there's such a demand for our profession, that salary is quite a bit higher than it has been in past years. I don't know necessarily that, if there were to be an influx of hygienists, that salary would come down. But right now it's around that $38 to $45 an hour.
When you're thinking about the dental assisting career and the dental hygiene career, what would you say was the least satisfying about those careers?
The least satisfying. I don't know that I could describe something. I think probably I'll say it wasn't the least satisfying thing for me. Something that maybe caused me a little bit of stress, I'll say it that way, is when you have patients coming into the office who are in pain. And sometimes it can be difficult to make a determining or, a determination of like the definitive cause of that patient's pain. And that's what a lot of people go into healthcare for, because they want to help people. And you don't like to see people coming in with pain. And in some instances, it's very obvious what's causing the pain. And immediately, this is the action I need to take to help this person. But when it's one of those situations where it's not very obvious, sometimes you take on that burden and it stresses you as a clinician wanting to try to help someone, and you feel like, you're not able to do what you need to do.
I can imagine when you think about the nerves and how they can radiate pain to different parts. And so I might go, it hurts here. Well, you're going to have to narrow it down.
Right,
There.
right,
It might not be that easy. But
exactly.
on the flip side, what's the most satisfying?
The one thing that I really have always loved about dentistry is you can immediately see the difference that you make for someone. So, and it can be a very simple thing, like a patient wants to have their teeth whitened, and you can instantaneously, depending on the type of whitening they have done, sometimes they can walk in the door and out the door and have very bright white teeth. So they have that instant gratification and get to see the improvement you've made. If they have a broken tooth and you fix the broken tooth, you immediately get to see what's been fixed. Where, let's say a patient, they break their arm and they go to the doctor and they have an x-ray and they have to wear a cast, and they wear the cast for weeks. And then they get the cast off. We know the arm isn't broken anymore, but you can't really see that the arm's not broken anymore. Where in dentistry, you can actually typically visibly see what you've done to make the improvement.
Absolutely. And, a smile is one of the first things you notice about people.
Mhm.
So to make
Yeah.
somebody feel confident in their smile, it's a fantastic thing.
Mhm.
You talked a little bit about the education that was needed. So remind the students, if you want to be a dental assistant, you have to go to school for this amount of time. If you want to be a hygienist, it's this amount of time.
Yep. So, and I like to bring this up because it depends on the state that you're in. Um, some states have 4-year dental hygiene programs, which just to enter that dental hygiene program and graduate, you will it will result in a bachelor's degree. In some states, it's an associate degree, so it's a 2-year degree. For dental assisting, it's a similar situation where in some states it would be a 2-year degree, so an associate degree, but there are also programs that result in a certificate. So the program itself might be just a little over a year or about a 12-month period of time and result in a certificate. So it really depends on the state that you're in. If we're going to speak directly of Florida, um, the dental assisting program can result in both a certificate with associate degree option, and then the dental hygiene program is an associate degree.
Okay. And I know
And it,
you work at State College of Florida.
yes,
So you're,
ma'am.
you're
Mhm.
working with the dental hygienist there. How are they paying for their education?
So that depends too. We have some students who seek student loans and they go through the financial aid department, and they can also not just get student loans, there are grant opportunities. Sometimes students will have a Pell Grant, which pays for their education. They might have partial funding through grant funding, and then they may have to use some financial aid assistance as far as student loans for the remainder of that. There are some programs within our state through Suncoast that they have some programs for health professions that are high demand positions within the healthcare industry that they provide. They're a funding source for students, and it's a similar to a grant that they can receive to help them pursue their education. And then there are some students who they're able to pay for their tuition without having to seek any of those avenues.
Do any dentists out there kind of grow their own? Do they maybe they bring somebody in and as assistant and help them go through school?
I think that some of the corporate offices have some programs such as those where if they have someone who's been working in their practice who decides to go back to school, they will help support them. I don't know the full details of, if that's a full tuition coverage or if, it's a partial
Sure.
help with the tuition, but I think there are some programs with the dental offices that do help with that.
I think it certainly doesn't hurt to ask.
Absolutely. Yes.
Go
Yes.
for the scholarships, go for the grants, go for the loans, go for employee tuition, any help you can get. For
Absolutely. Yes.
Now, you have shared with us how you kept working at it, kept plugging away, got your bachelor's degree, but
Mhm.
that wasn't enough for you. You didn't stop there. What did you do after
Right.
that?
Right. So, with the profession of dental hygiene, we've talked a lot about the clinical side of things and working in an office and treating patients. But there are a lot of hygienists who they don't want to stop there. They don't want to treat patients um, every day for the rest of their life. They want to, what they term in our profession, they want to get out of the op. They want to do more. So there are opportunities where you can do like me, I'm an educator, or you can be a researcher. You can work in public health. There are be a sales representative. There are a lot of opportunities. But in order to pursue those opportunities, you need more than the associate degree. So at a minimum, to pursue those opportunities, you would need a bachelor's degree. And it doesn't necessarily have to be in dental hygiene or dental hygiene education. I knew that I wanted to go into education, so I did mine in dental hygiene education. And because I was an educator within a university setting, I was able to pursue my master's degree, and I have a master's in post-secondary education. And it's because I knew that I wanted to continue on that path of working within a college or a university setting and educating new healthcare professionals. And as I've transitioned into my current role as the Assistant Dean of Health Professions, it's a more of a leadership role. I pursued my doctoral degree in educational leadership because, like you said, no one can take your education away from you. And education is an opportunity for you to continue to grow. And I had an instructor when I was in dental hygiene. She is a dear friend of mine. She was a colleague, and we still frequently talk to each other. And she encouraged me when I was in school that I needed to stay on a path of lifelong learning. And out of default within health professions, we have to do that because you have to complete continuing education to maintain your degree or your license. But I think anytime you can have more degrees, it gives you more opportunities and it opens the door to more things. Not to say that some people are content if, they have their dental hygiene degree and they like working clinically with patients to stay in that area. But we have a lot of students, and I'm speaking, more for my students now who are graduating. They're looking beyond clinical and saying, I do want to do that, but sometime down the road, I might want some other opportunities. And those are the students who are pursuing the bachelor's degree and going on to do those higher level degrees.
It's wonderful that this is a career that allows them the flexibility to keep
Mhm.
going. Because
Absolutely.
so many students don't realize, once you get out of high school and college, how many years are you going to have to work before you can retire? It's a
Yeah.
lot, sometimes more than 40 years. So you better love what you're doing. And if you've got a field that will allow you to continue to grow within it, well, that's just a bonus
Mhm.
opportunity.
Yes.
We are nearing the end here. My last question for you is, what is your best piece of advice for students who may be interested in following this career path?
Um, so I wish someone had told me this when I started college. And I changed my major a few times, and that's why I had the family member make a recommendation to me. I think everyone could see I floundered a little bit, but the health programs, they are limited enrollment programs. So that means that there are limited seats. And students need to be dedicated and really be mindful of the courses that they take and how well they do. Not to say if a student has a semester where they don't do very well, because I will say when you transition from high school to college, it is a transition. There's a learning curve there, and you have to kind of get acclimated to the workload and the classes that you're taking. So if you don't do very well the first semester, that's okay. You can always make improvements. But with that in limited enrollment and the limited spacing in the programs, that means that it's very competitive to get into them. So that's where we have to be mindful and try to do the best that we can. And what I've noticed from students is when they're doing their general education courses, sometimes they might struggle with the topic. And I always tell students, if you struggle with a topic, let's try to get a tutor or get assistance from, a lot of times your colleges have different programs on campus to help you with your study skills, your learning skills, so you can be your best self and do the best that you can in your courses. And
Yeah, you
I
wouldn't
encourage them to start that early.
that's great advice because you wouldn't want to trash your entire college career because of one topic that you struggle with. Get help with that, and then after that semester is over, you're moving on. You've got
Right.
other classes to take. That is excellent advice, and I don't think I've ever heard that advice before either.
Oh, really?
Yes, I hope everybody's listening out there.
Good,
That
good.
is wonderful.
Mhm.
Thank you for sharing. And thank you, Kim, for being here with us today, answering all of our questions. I really enjoyed hearing about your journey. And I believe this interview will give students a better understanding of what the dental assisting, dental hygiene career is all about, and ways you can continue even beyond that as
Mhm.
an educator, as a researcher. So it's wonderful that you were able to be here today with us and share. And I'd like to remind the students that we have 6 free Reach Student programs. Give me a call, send me an email, let me know what you're interested in. I'm happy to chat with you, give you some more information. Thank you so much, Ms. Baston, for being here, joining us today. We sure appreciate your time.
Thank you.